Okay. Today we are meeting with the generous giver of her time. Once again, Kelly Maynard. Thank you, Kelly, for joining me. We had such an amazing response to the article that Kelly provided last week on fascia. It's Fascia February. And as I said, we've got a few talks lined up each week, typically towards the end of the week. I'll get this up for the weekend, Kelly, just so you know. But there was a lot of good questions that hadn't come to my mind when I maybe planted the article, and the experience that Kelly and, of course, Jennifer, who couldn't join us today, brings as a therapist herself. There's common questions that many of you have. We see them posted in the groups. So we thought we would just pick a few top ones that are kind of probably in the front of your mind. And I'm going to ask Kelly those questions. And because she's such a wealth of knowledge, I'm going to have her field those. It's important. Many of you may or may not realize I personally do not have lipedema or Derkham's disease. I am a 50 plus menopausal woman, so I can relate, but a lot of the times I can understand and offer guidance, but I'm not living with these conditions and navigating them on a day-to-day basis like Kelly and Jen are. So your feedback is just so invaluable, Kelly. Thank you.
I appreciate you asking me back, and I'm excited to get to the questions because I know back when I didn't have as much knowledge as I do now, I had a lot of questions too. So let's get to those and see if I can give a little insight.
Well, the first one's a big one, and
Okay.
there's never a black and white with any of these. This is just to help you kind of navigate in your learning journey. We can't do this for you. We can't learn this for you, but we're happy to share the insight that we do have. So the first question that comes to mind is for fascia specifically. So if you're wanting to go learn, you want to go see a therapist that's well versed in this. We've touched on this in past chats, but can I just go see any therapist and get help for my situation? Or am I looking for someone more qualified, someone myofascial release? You know, there's terms out there, but we don't necessarily understand the terms. Can any therapist help, or are we looking for someone that specializes in myofascial release? I think that's the correct terminology.
Mm-hmm. First, I want to say a therapist can be helpful, but it's also not 100% required that you must have a therapist to positively impact your fascia. And that's a whole different topic. But it can be overwhelming. So today we're going to talk about if you want to go seek out a therapist. It actually is really helpful. That's how I first started dealing with some of my issues with fascia. I just did a Google search for my local area. I searched some key terms that I had come across, like myofascial release, connective tissue, trigger point therapy. There's different little, keywords, to see if anybody in my area had any of those listed on their website or anything. And some of those terms are very specific, like myofascial release. Or there's different schools of training, like ASTEM is a specific therapy that people can get trained in that addresses fascia. And so sometimes therapists are not allowed to use those types of terms. Like if they're an ASTEM certified therapist, they can use it. But what if they just are familiar with those techniques? Well, then they wouldn't be able to list that on their resume.
Or as advertising and claims.
Right. They couldn't claim that they're that type of therapist. And also some of those terms, I think therapists know, the general public doesn't know what those mean. And so while they may have skills in those areas, they may have experience in those areas, they may not list those types of things in their advertising. So honestly, it's kind of hard to tell sometimes. The person I found was actually a sports chiropractor. And I didn't want to go to a chiropractor because I had in my mind this whole, I don't want to go get my back cracked. I want to reduce my pain. And yes, while if your spine's out of alignment, that will reduce your pain. But I was looking at it more of as a fascia, not as, bones and joints.
There's a stigma with the word chiropractor.
Well, there is. And some of them, people get caught up on like, what is the label? Yeah. What is the degree that they have? What is the certification that they have? And really, unless you speak to that specific person, you're not going to really know what extra training they have
Yeah.
or what extra experience they have. Because there could be a massage therapist who's worked on clients for 20 years and could very much improve your fascia health while not advertising that they are a trigger point release specialist or not having a certification in a specific fascia therapy. And so that doesn't seem like it helps much to answer the question.
No,
But
it's what you're getting to is it's important, like you were checking out a new doctor. Sometimes you have to take that step to have an appointment and do the face to face.
right,
Excuse me. Keeping in mind also, they don't know anything about you. So
right,
it's like an interview. It works, you're interviewing and understanding what they're capable of just as much as it's you presenting what you're dealing with. And that's part of the
right,
discovery process you may need to go through, especially if
right.
you don't have a lot of access to those type of people in your area.
So I think like an initial phone call to their office
Yeah.
is would be good. The person that I ended up going to gave a free initial consultation so that
Awesome.
you would feel comfortable if you decided to choose them as your doctor. Both sides would know exactly what you're getting. I think the other thing that's important to note is we get so scared that we're going to go to a doctor and they're going to dismiss our lipedema,
Mhm.
or we're going to go to a therapist and they're not going to know about what lipedema is. Honestly, I go to this guy. He has no idea. I mean, he's heard of lipedema. He generally knows something about it, but he really doesn't know about it. And he said, I don't care what the diagnosis is. I treat fascia. I treat fascia pain. I treat fascia I restore fascia.
Yeah.
And let me,
Regardless of how it's been affected.
right, because once you understand more about fascia, how your fascia got to this messed up place is not as important as the person that you're seeing understanding how to undo that and how to help you. And so I really do understand because I've been there of a doctor saying, you're not relevant to my practice because you have this condition and I don't want to learn about it.
Yeah.
And you need to find a doctor who says, I do have the skills to help you. I do understand about fascia health. I can help you. And I respect that you have this diagnosis, but that diagnosis is not my specialty. But the tissue that you have a disorder in is my specialty. And so I think you're going to find with a fascia person, even a massage person, a person that you go to, they may have a lot of knowledge that can help you, but they're not a lipedema doctor. And
Yeah.
so we need to
Which
set that
isn't why you're
aside.
there. Which isn't why you're there about the fascia.
I mean, you are there because you're lipedema. Lipedema is a connective tissue disorder. That's another word for fascia.
Mm-hmm.
But you're not there for them to diagnose you with lipedema. And so you have to kind of compartmentalize because our medical system is so compartmentalized.
Yeah.
And you have to say, okay, can I trust this person? Is this person listening to me? Do they have the skills I need? And you'll know. I mean, you can go to 1 or 2 appointments and know if you need to fire that doctor or keep that doctor.
And a relevant point here too, for those of you that have a diagnosis, great. There's many of you that don't have the diagnosis. It doesn't mean that you need the diagnosis to specifically target an area that you've educated yourself on.
Right.
To improve your situation, right?
Yeah.
Most
You
don't have a diagnosis, so don't wait for the diagnosis before
no,
you check this out.
no, don't live in pain because you're seeking out that doctor who will give the diagnosis.
Yeah. It's not worth it.
No.
Why wait? Why wait?
There's not really a reason to wait to get out of pain and to start healing your body.
But I think, I promised Kelly I wasn't going to go off on any Debbie tangent today, but my experience, because I don't have the condition, so I'm more on the receiving supportive end, front line, is it all stems back to that worst appointment you ever had where you were made to feel this small. We become indecisive. We question our own rational thinking. You need to just start trusting your instincts and listening to yourself more. You don't need to go to university for 10 years to become an expert in a subject, right?
Right.
you've been living with this longer than most people have known about it. I've been a vibration plate specialist for 20 years, and I didn't know anything about lipedema until 5, 6 years ago.
Right.
Yet I'd been probably dealing with it my whole life. So, even though the person that you are seeking pain management from in this situation, I see too many of you thinking this diagnosis is going to come, and it's not only going to change the care, but the access to it. You still have to be the one to go out and seek the person. So do the homework now. Don't wait for the diagnosis, because it's not going to necessarily improve the level of care that you get access to. I'll leave it.
Yes.
Sorry for
Agree.
probably screwed her up where she was in her questions now.
No,
too.
I'm good. I'm ready for the next one.
And I'm glad that you raised A-stim. It's almost something we should talk about in a separate chat. I've had not a lot of questions, but I think it's one of those newer terms that is being discussed a little bit further, and it's a good tangent to this. So we might come back to that in another chat. So
Well,
the next question, go ahead.
Can I say one thing? I've also heard I will only go to a VODR specialist. I will only go to an ASIM. I will only go to a this or a that. And
Yeah.
we really, really need to just take a step back.
Yeah.
First of all, there may not be one of those people in your area. And
Absolutely.
travel is hard for those of us with some of these conditions. It can be almost impossible. And so we really have to take a step back, think about where we are, what is our budget, who is available. And I mean, I don't live in a huge town, but I did find someone who could help me. And I think that if we hold on to hope so much. And if we read this type of therapist helped a person with lipedema, then we grab onto it. And I understand that. I really do. Because like I said, I didn't want to go to another chiropractor. I've been doing that for a while. But this decision to go to this specific one who had this additional training was a very good decision.
Think of it like, I always kind of equate these things to like a haircut. If you got a bad haircut, you wouldn't go back, A. And, we're not afraid to try a new hairdresser, right?
Yeah.
So sometimes you got to simplify the thought process. And I'm not saying you're not going to have a setback. But sometimes I know myself as someone that supports you, I get stuck in my way, and this is my way. And sometimes because I know my area of specialty too much, sometimes, oh yeah, we could have tried red light, or, oh, we could have done some infrareds. Sometimes I got to pull myself away from my area of expertise. And that's a good point. You're dealing with someone that has spent a lot of time and money educating themselves in a specific modality, and they have to continue. It's hard to be multi expert, and there's so many different techniques and approaches out there nowadays. You do have to a degree, at least do a little bit of surfing. It's hard for me to speak intimately about treadmills because I have a big bias when it comes to vibration plates. Not exactly the same comparison, but I think you know the reference I'm making there.
Yeah.
And in my experience, I remember when Kelly, because this was quite some time ago that you went and saw this guy. I remember how surprised you were that it was some sports therapist guy, but fascia in the fitness world, oh man, everybody's talking about it, knowing about it. But the translation somehow medically to some of these chronic conditions and the pain that you guys are dealing with, somehow it's been lost in translation. So I'm seeing more and more groups, podcasts, fascia. A lot of people think it's the hit word right now. I think it's just making a comeback in some ways. A lot of people are, it is a connective tissue, as it's one of probably the most important connective tissue in your body. We just don't think of it that way. So the next question we had, speaking of pain, will fascia work hurt when it's being done? So when I'm laying on that table and my practitioner is doing work on me, is it going to be painful?
Yes.
I saw it. I think I was going to be the answer. I was trying. Yeah.
Okay.
Great.
That's the short answer. And with lipedema and hypermobility, many of us have hypermobility as well. We already feel more pain. And so when we're we already at that pain threshold where we're feeling pain almost all day long, no
Yeah.
matter what we do. Yes, when you do something else that would probably be at least a little painful for the normal person who's not always feeling pain, yes,
Yeah.
it probably will hurt. I think it helps to set yourself up knowing this is probably going to hurt um, a lot. It might hurt a lot.
Yeah.
And many people don't want to go through the initial pain. The good news is that if you find the right practitioner, they should listen to you. You can tell them, and please don't be shy about telling them. Tell them,
Advocate for yourself, especially to Kelly's point. If you're dealing with someone that maybe doesn't understand the sensitivities that, maybe they're awesome at fascia. I usually find any therapist that I work in the sports realm, they're curious. They tend to want to learn more.
mm-hmm,
So they tend to be more receptive than that specialist that you've waited 6 years to get the appointment with.
right.
So
Well,
be vocal, advocate for yourself.
yes.
Absolutely.
And if you tell them the condition that I have is probably going to make this more painful for me than it does other patients because I have this disorder in my connective tissue. If it's the right person, they will listen. The
They'll be curious. They'll be curious.
Yeah. And my sports guy, he watched me carefully, like because I'm pretty nonverbal with pain. And also when you're sitting in an office, you don't want to like scream in the office or
Oh, she's here again.
you tamp down. Yeah, you like tamp down those reactions. And so he watched and he'd be like, "Are you okay? Do you want to stop? We can back off. And he really cued in and listened to me and respected my limits. But the other good news is the second time I went to that therapist, it hurt about 50% less after one treatment. And most fascia therapy also, they will stay in one area not more than probably 2 or 3 minutes. Okay. And so if you can get it in your mind, this hurts, but it's not going to last that long. If you can slow down your breathing, if you can just like sort of melt into, okay, this is going to hurt, but it's almost done because it is almost done. Yeah. It really did decrease. My pain decreased on the second treatment about half, and the third one about half again.
Awesome.
Your fascia reacts quickly because there's different fascia in your body that has different jobs, but the fascia that we're talking about,
yeah,
that's the superficial under your skin and the fascia around your muscles. That fascia's job is to adapt to whatever your body's doing.
Yes.
And so it adapts.
Or not doing.
But it adapts, and it's amazing the difference in pain. I'm not promising that it will be as drastic as mine was. And honestly, the different parts of my body that have lipedema, they all respond a little bit differently.
Yeah.
Some of them need a little more gentle approach, and some I'm like, okay, I'll go in, I'll be in pain for 3 minutes, and then next time I'm in this doing this for 3 minutes, it won't feel like this. And so it'll probably hurt. And honestly, that was about 4 years ago, and I have enough skills now. I do pretty much everything at home, and it still hurts, especially if I'm tired, if I've overdone it, if I'm not hydrated. I mean, there's all kinds of factors. Yeah. If I ate something that made me have inflammation, there's all these factors that will make you have more or less pain. And so it will hurt, but there are things that you can do to help yourself.
And as you've gone and gained the experience, I had a chat with some of my moms at coffee this morning about, the only thing we can give our kids all the lectures in the world, but it's the life experience that, learning takes time. Learning your body and how it reacts to these things takes time. And I'm going to do one more tangent. It's February, so the New Year's rush is over. Forget the lipedema community. New Year's is my least favorite time because everybody's, feeling that pressure of the New Year's resolutions and so forth. And, if it was a pill, you'd give it 30 days. We have somehow become this society where we think when it comes to our health, even though it might have taken us 5, 10 decades to get to where we are, we have one poor experience or we don't see the immediate overnight success, then we dismiss it after a day. So
Mm-hmm.
I before you go to these appointments or there's things that I have provided, Kelly have provided. You know, if you're one of those on the high end of the pain threshold and it's stopping you from doing this because, you know, for a day you can't handle that pain, what do you do in other areas of your life to prep for that? Maybe you're spending some time in your infrared sauna. Maybe you're using your vibration plate. Maybe you need some manual lymph drainage first before you go deeper. Maybe you've never been for a massage in your life. You know, maybe this wouldn't be the first one to go for. So, you know, look at yourself and be brutally honest with where your tolerance is at and how much time you personally are prepared. And I think to Kelly's point, if you mentally prepare yourself, you know it's going to hurt a little bit. You know you're probably going to be a little sore and fatigued tomorrow. Look at it like any other therapy that you've tried. And if we're mentally prepared, we tend to beat ourselves up a little less. And there are lots of tools that many of you have, your lymphopress, whatever it is. There's lots of things that you could do pre and post myofascia treatment to reduce the pain, ramp up the lymphedema. There's lots of things that you can empower yourself with, even if it helps a little bit. But I've been for myofascia when I screwed my knee up back in the day. I just didn't know what it was. And yeah, it hurt like probably, I'm not going to say like child labor, but there was one tendon that guy hit on my outer thigh and it was pretty damn close. But the next day, it was still tight and sore, but it felt the movement had improved, the stability had improved, and it left enough of an impression. And I've done the electroshock treatments, I've done everything but get the knee replaced. But it was enough for me to continue to go see the gal
Mm-hmm.
I was seeing at the time. Whereas I used to be that person. If it hurt, I'm not going back, right?
Mm-hmm.
You've talked about this in past chats with Jen. Inflammation happens. That's part of how we heal. And some of you, the inflammation presents more pain. This is going to be another thing that you do that's different, that improves your body, and it's going to take some time. But anybody I've talked to, including Kelly, it does tend to get better by the second or third go around. So just be patient with yourself and be vocal with your therapist, especially if you are that ultra sensitive, I bruise when Debbie breathes on me type of person. That's another thing to consider as well. Um, what else were we talking about with Kelly's dude? I'd love to get him in for a visit. Okay. So this is an important question, and I might have an add-on to it as well that ties in to the work when it's being done. Yes, it is going to hurt. In the article, Kelly talked, if you haven't read the article, I will drop that in the comments once we get this aired. But we talked a lot about adhesions in the fascia. So will stretching after applying heat help release my adhesions?
Okay. And just a heads up, Deb, I have about 10 minutes, so I'm going to zip as
Yeah,
fast as I
zip through
can.
that one.
Okay.
Everybody's going to go, you can't do heat. Yes, you can. Watch the other chat.
It'll watch our other things. Heat is good for recovery. It's good for prep. It actually will help the pain. If you can be warm, if your tissues are warm, it will reduce the pain. Cold tissue is not hydrated. It's not moving. It's not good. But if we warm it up, it brings back flow. It makes it more receptive and adaptive to treatment, and it'll help in your recovery process. So a quick little illustration. I explained this to my 10-year-old daughter yesterday, and she totally got it. We were talking because she goes to dance. She was talking about her dance teacher. They have a stretch and strength class. So I explained this to her, and she's like, "Oh, that makes sense." So here's what I'm going to explain. So stretching will not release adhesions. And here's why. If you have, can you see my rubber band?
Love it.
Okay. This is a tissue in your body. Go with me here. So stretching, the more you stretch, you can maximize how much this will, like maybe you're only this flexible, but as you work on it, you can get this flexible. but you'll only get this flexible.
Okay.
Because why? Because just like this rubber band, this is as far as it goes. You
Yep.
can only get to the maximum stretch. Now, if you had a smaller one, it obviously wouldn't stretch as far. So as much as you stretch, you only get to the end of what your body could, how far your body could go.
Yep.
So the thing about an adhesion is it's like if you had I was going to tie it, but I'm short on time. If you had like a kink in your rubber band, right? So then this part will stretch and this side will stretch, but where this kink is, or this adhesion or this scar tissue, it's never gonna stretch. And so while just stretching this is not removing my fingers.
No.
So what a fascia therapist does is work this out, this kink or this scar tissue, and it restores it to be part of I just flicked that across the room.
Nope.
It restores it to be part of the tissue that will again respond to your stretch.
Makes sense.
So when you have an adhesion or a scar tissue, that's collagen. Your fascia is collagen and elastin. The collagen makes things strong. The elastin is elastic, stretchy. And so you're wanting to break up that adhesion, that scar tissue, that fibrosis. It goes by a lot of names. It's basically the same kind of like blockage in your fascia that doesn't allow your tissue full range of motion, healthy exchange of fluids. There's a lot of things. Communication with other cells.
Back to the heat, logically, and even if we're using your rubber band as an example, if it's warmer, it's going to make the work on that adhesion, knot, whatever, there's a bazillion terms for it. It's going to make the therapist's work more effective, and it's going to reduce the pain. So heat can be tolerated. There's another chat we've done about that, but that's very logical. And this is one of those, you'll never forget her little elastic band demonstration. This is part of the learning. See, we're hoping that when you leave here today, you're armed with more common sense knowledge than what you didn't know yesterday, what you knew today, right?
Yeah.
And so the heat, at one point in my life, what would I do without all your brains?
The heat will help it respond. It's like the difference between trying to like pull apart something frozen together or like something melted.
Makes sense.
You want it, you want it to be warm in order to respond to
a warm ice cream scoop cuts the ice cream better than a cold one.
Yes.
Okay.
All right.
Next one's kind of related, so I'll move on to that. It's when we're releasing these adhesions, which we just sort of talked about, will I experience an inflammatory response and be really sore the next day? Which we kind of already answered to a degree.
We kind of did. This is really, it's kind of quick though, because just like if you went and did a workout that you're not used to, or if you've ever been to a massage therapist who did a really good massage on you, they'll tell you, could you please, when you leave here, you might be sore, hydrate, rest, all these things, all the common sense things. And so we're going to need to do all those common sense things, but also ramp those up because we're already living with the chronic illness where we have to do more self-care.
Yes.
And so I would say, yes. And one of the most common things that people don't realize is it can just make you exhausted.
Absolutely.
It just takes all that tiny bit of energy you have sometimes where you're dealing with this chronic illness and you just feel like, I can't go on. Well, that little bit of therapy that will in the long run help you, it just takes the rest of that. Your body is trying to heal. You're introducing that healing component in there when you get these types of therapies. And so your body uses that little bit of energy you had, and then it needs more rest. And so be prepared for that. Hydration, and not just water, but also electrolytes. Very important.
In the article, Kelly summarized each of the key points, and some of them, they're probably reminders more than, a nagging lecture but sometimes it's, you get busy. Self-care, and I'll go back to a different discussion I had with Marianne from the Warriors. Everybody has self-care, but you guys have all this lipedema or Durkheim's disease, you
Right.
have all this extra care on top of, we all need self-care, right? So be kind, be patient, and give it time. It took time to get here, right?
Hmm.
Um, the last question, because I know I've got about 2.5 minutes of your brain left. And in March, basically what Kelly's talking about is, for those of you that are good at doing the work, I would say as a population, sometimes we don't talk enough about the recovery. So you've done the work, but there are things that you can do to help with the energy, the pain, those next day things. And we're going to do a few more talks in March, more recovery focused. We've been beating you up enough about the self-care. What can you do when you do too much or not enough self-care? There's some recovery we're going to talk about next month too. So,
Yeah.
the last question I had, and this may or may not be a short one, but I think we've kind of answered it as well. So, why, let's say, let's say I had a treatment on my calves. My calves were tight, and I went for some myofascia work on my calves. Why do I feel better for a few days and now it hurts again? Or perhaps maybe I had pain in a different area. So what can I expect? If I've gotten relief or some progress in one area, is there a ripple effect elsewhere?
So fascia is connected everywhere. And many of us have seen like these little diagrams where they show fascia wrapping around the body. Um, your fascia in your feet is connected to your shoulder as it goes up your body. Often also fascia crosses. So it can cross in the front of your body, some crosses in the back. And so it doesn't seem logical unless you really have studied the fascia lines, but you can have work done like on one side of your body and the next day, like what if it was your right side of your ribs, but the next day you're having pain up in your left trap and your neck.
Yeah.
And people say, well, that caused that. Well, yes and no. It did cause it, but it could have been that you had tightness here that was causing pain in your ribs. And when you released all that in your ribs, you noticed that this hadn't been worked on. So this was then tighter because it gives and takes. It's all connected. So when you pull on one side or you release one side, it affects something else. It could be opposite side of the body or same. And along those same lines, excuse me, like you said, if you work on your calves and you're like, wow, this is good. And then 2 days later, you're like, why do they hurt again? I had this done. Well, that's because your calves are connected to other things. And so if you only worked on that frozen shoulder doesn't exist in isolation. And
Yes.
if you don't fix everything that radiates out from that, all the radiating parts are still like this. Now that may be loose, but the rest is all crunched up still. And so really fascia work is for an acute injury or an acute pain, yes, you can go to the pain site, but there are also all these cause sites. And a good fascia therapist can trace the most likely cause sites and they can treat that place plus your pain site so that that whole fascia line is released. I've got to go, but I'll say this last thing. If you're hypermobile, this is extremely important to know about your body as you're getting fascia work done. And most people with lipedema are hypermobile, even if you haven't been diagnosed. I think we've touched on that before. But when we have hypermobility, our whole body is in a state of tension. Because if we're not in that state of tension, because all of our joints are lax, they'll just slip out of place. So our muscles are always like in this semi state of tension, and we don't realize that we are, but we're holding ourselves there. And so if you go get some sort of fascia work done and one of those places gets looser, it just has a ripple effect. I did work on my feet and calves, and my whole upper back just felt locked. And I hadn't touched my back. I hadn't done anything to hurt my back. But I think it's a blessing and a curse when you're hypermobile. You can feel everything in your body from one little point. Like you can feel the ripple effect much more than other people can. And so you just want to cue into that. And like we've said a million times, know your body, your own body, and what it does, and pay attention because it's talking to you and it's giving you clues and it's trying to tell you things. So especially when you have lipedema, hypermobility, you also want to communicate to whatever therapist you find that you need a gentle and slow approach, especially at first. Because if they just go full in, like they're used to working with, a high profile athlete, and they just go full in on you, you could feel really bad the next couple of days and have pains in places you didn't know. And that's not to scare you. It's just to say, be aware of your own body and pay attention to where those connections are so that you can help a therapist help you.
Advocate for yourself.
Right.
I know you've got to go, so I'll just say a quick thank you and do my own little wrap up. Appreciate your time. Have dance, I think you have.
We have dance again for my daughter. Yeah.
Awesome. Kelly's a go-go dancer on the side, if you didn't know. All right, I will let you go. Thank you for your time.
Thank you so much.
Fascia is not something we can completely wrap up in a 1 hour chat. I'm simply going to relate a few vibration machine references and fascia, as Kelly so cleverly pointed out, it affects every avenue in your body, very much the same way that vibration does. So the last point Kelly was talking about, maybe you've done something in this area and you're feeling it in this area, whether you're dealing with lipedema or not, our body is ever compensating for deficiencies within our body. So if you've got a bad knee or on one side or a bad hip, we tend to shift the weight to one side. And sometimes where pain or symptoms are presenting aren't necessarily the root cause of where the issue is. Sometimes it's that compensation factor. So same with going to a therapist that is skilled and working on your fascia. It's you're not going to do a whole body treatment in one day. You'd be there all day, but it's understanding that, again, it's taken a period of time to get to the situation you're in with your body. It's going to take a little bit of time and patience to work things out. And if you do have any questions specific to the chat that Kelly and I have had today or her article last week, please don't hesitate to reach out. So again, thank you for joining me today and Kelly. Recovery and allowing your body the time to implement all this good work that you guys are doing is also very, very critical. So we'll be doing some more discussions in March specific to recovery, post-treatment, post-exercise, these types of things. So thank you for joining. It's Fascia February. If you didn't see the article from Kelly that this session today is a follow-up to, I will have that posted in the comments. Thank you for joining me and have a great rest of your week. It's Valentine's weekend, so if you're celebrating, happy Valentine's Day.